We haven't had this for so long.
I'm very happy we can go out to a club and just have fun.
Sweden has lifted nearly all COVID-19 restrictions. Stockholm's metro is full once again, and the authorities are no longer encouraging people to work from home due to the pandemic. Many here have welcomed the changes, but there are critics. The Scandinavian country has had some of Europe's most relaxed rules. They're to blame for its nearly 15,000 COVID deaths, according to proponents of tougher restrictions. So did Sweden get it right?
Welcome, I'm Ben Fazulin. I'll put that question to an expert in a moment. First, a closer look at how Sweden is faring, because while most countries imposed a lockdown in response to the first wave of COVID, Sweden did not. A study shows if it had, it could have reduced deaths by some 38%.
From the outset, Sweden took a different approach to controlling the coronavirus. Rather than impose regulations and lockdowns, the government provided recommendations to the public based on expert advice. It reminded citizens to keep their distance and to wash their hands regularly.
We have a habit or a culture of working with recommendations which have proved highly effective, actually. We find that the Swedes have in generally been very careful to follow the recommendations and restrictions.
But many experts think Sweden's model was a failure. More than 14,000 people there have died from COVID-19. Neighboring Norway introduced more rigorous rules and reported only 850 coronavirus deaths.
They didn't consider the chances of a general spread of COVID-19 in Sweden to be very high at first, and therefore they didn't actually put in more restrictions early on. So initially I think they did too little, too late, and that's why a major reason to why we have high casualty rates in Sweden.
The Abba Museum is one of Stockholm's most popular attractions. Tourists are admitted without a coronavirus test, and social distancing is not enforced.
For me, it's very typically Swedish how we handle this situation. And I think a lot of the decisions that has been made from authorities has been based on scientific facts.
Unlike their counterparts abroad, Swedish scientists have cast doubt on the efficacy of masks to reduce the spread of the virus.
It's not just putting on a mask, it's you have to take them on and off again, and then you use your fingers. The quality of the masks is also a certain point of view, working both ways.
But experts elsewhere say it's indisputable that face coverings provide protection. Few people practice social distancing in stores and restaurants. And although many people work from home, schools remained open even when infection rates were high. Sweden's Commission of Independent Experts says the country's low COVID-19 mortality rate and the fact that most of its elderly population is now vaccinated justifies the removal of remaining restrictions.
And let's talk more to Arash Haidarian Pasha Khanlu from the Swedish Defence University. Too little, too late, you said. What should have Sweden done differently?
I think that the risk assessments should have been more careful, and they should have taken the evidence that was accumulating across the world and the risk assessment that WHO was taking and follow that more closely, because they were overly optimistic at first. And also, I think that they should have introduced the use of face masks earlier on, done more testing earlier on, and more number of testing, and they should have taken care of the elderly better as well.
So testing, face masks, protecting the elderly. A study called The Lockdown Effect shows a 9-week lockdown in the first half of 2020 would have reduced infections by 75% and deaths by 38%. Would the total death toll have been that different with a lockdown the first time round?
It is very hard to speculate with regards to these issues. It's a hypothetical scenario. We don't really know exactly how much less it would have been. And also, there is studies that shows that early restrictions, not necessarily whole lockdowns, might have positive effects as well. So you also have to consider the fact that hard lockdowns have disadvantages effects as well when you're taking all of these things into questions. So we cannot say for certain what the effect would be if there had been hard lockdowns implemented in Sweden earlier.
I guess you're talking about the economic effects, but why is it so hard to implement a hard lockdown in such a rich country?
Well, there are economic effects, as you mentioned, and also there are other effects as well. For instance, a lot of countries decided to close down their primary schools while Sweden didn't do so. And there have been studies that shown that keeping the primary schools open in Sweden has not had a major effect on the spread of the coronavirus, while closing down schools we know have adverse effects on the children, and especially the ones who come from disadvantaged families. So we have to take in a lot of factors into account before deciding on a lockdown.
The government did end up imposing restrictions, but why did it take till only January this year, for example, to make masks mandatory?
It has a lot to do with the assessments of the Swedish Public Health Agency that had a lot of authority in how Sweden handled the coronavirus situation. And they thought that initially there was a lack of scientific support for face masks and its effect on reducing the spread of the coronavirus. They also thought that all the itching that the face mask might induce might actually help people or would have caused people to get infected. And finally, there was also concerns that people with light symptoms would be more likely to go out in public if they had face masks and thereby risk spreading the virus further.
This itching effect, is that something that's come up in other studies?
I'm not aware about the studies of itching. They were referring to examples, but I'm not aware of the particular studies on itching.
What are your expectations then for the next months with restrictions being lifted? How people are now going to act? Will numbers develop differently?
That's a big question right now. The proponents of this strategy argue that the vaccination rates in Sweden is high now. Over 75% of those who are 16 years old and older have taken 2 doses of the vaccine, and they argue that the death rates are much lower today than they were at the peak, so it's worth opening it up. But there are other experts who says we need even higher vaccination rates, maybe up to 80-90%, and there are also concerns about the Delta variant that is more contagious, and the fact that in some areas of Sweden the vaccination rate is lower. So there is definitely the possibility that the infections will rise. But in that case, there is an option to actually reinforce the restrictions again. But then, of course, by that time, some people will have been affected. And then you have to face those challenges that come along with that.
OK, we'll have to leave it there. Arash Haydarian Pasha Khanlu, thank you very much for joining us today.
Thank you.
Over to Derrick Williams now, and a question we've had before, but one worth playing again for you on the protection of the vaccine and the comparison to having been infected.
Does the vaccine give you different protection than recovering from the virus does?
This is complicated, but the short answer is yes. Both infection with the pathogen and being vaccinated against that pathogen generate protective immune responses, but they're different on a number of levels. How could they not be? During an infection through the nose and throat, the body is confronted with rapidly replicating SARS-CoV-2, while most vaccines injected in the arm work by only confronting the immune system with a critical coronavirus feature, the spike that studs its outer surface. Among other things, that means an infection provokes the body to produce a wider range of antibodies than vaccines will. The antibodies they prompt are more narrowly focused on the spike, but many experts think that narrow but powerful focus is a positive thing. Others think it could become a problem if the spike proteins mutate even further in new variants. But the truth is, we don't really know at this point which of the two, infection or vaccination, provides better or longer lasting protection. There are studies making that claim in both directions, but there are two important points touching on this topic that I think have to be made. The first is that we have good evidence that protection for people who have survived a COVID-19 infection can be dramatically strengthened if after recovery they go ahead and get vaccinated as well, which is why healthcare authorities recommend definitely doing that. The second point is that given the choice, being vaccinated is a much safer way to acquire protection from COVID-19 than getting the disease and surviving it. That might provide you with an excellent defensive response against SARS-CoV-2 in the future, but there's also a chance that you wouldn't live to enjoy it.
Nice to have you along. Stay safe and see you again soon.